Lugging shopping bags around, or you're feeling the ache from putting up holiday decorations, back pain can really hit at any time, which is why we have neurosurgeon Dr. Winston Capel here from Brookwood Baptist Health. And you are here to talk about something that a lot of people experience, and that is back pain. The phrase throwing out your back, a lot of people say that. Is that a real thing?
It is. So most people who have back pain have a baseline they live at where their back pain's pretty tolerable, and they have these flare-ups. That's the back that's out, so to speak. That's
throwing out the back.
Correct.
Okay, so do people come to you and they say, "Doctor, I threw out my back. What do I do?" What are some treatment options for some common back pains?
The good news, most people will get back to that baseline no matter what you do. But in general, most people who have back pain are deconditioned, so we work on their core strength. Most of them have a lot of inflammation because it's osteoarthritis that causes most of the back pain. That flare-up of the osteoarthritis is what brought them from that baseline to that flare-up. So anti-inflammatories, heat, frequent changes in position, those kind of things.
Okay, so before we came back on, I said, are there things to do besides surgery? Because we know you're a neurosurgeon. Your specialty is doing that, but you were saying surgery is the last option. You don't want people to get so bad that they need to have the surgery.
Correct. So prevention of back pain would be preferred, and so avoid obesity, avoid nicotine, avoid poor lifting mechanics, and maintain a core strength. Those are the main things to prevent it. So we encourage those things, avoidance primarily.
How has technology changed the way that you do your job and the way that you're able to help patients?
Well, it really depends. So if they fail the standard things that we talked about, it all depends on where their pain's coming from. The vast majority of pain is coming from the disc that separate the vertebrae. And so those patients will either be a candidate for a disc replacement surgery or a fusion. Most patients don't need surgery, but if they do need surgery, those are the two options for disc problems. 25% of all back pain is coming from this joint here called the Sacroiliac Joint, and there are great technologies for that are minimally invasive, highly effective in treating those problems.
Is that like the robot machine who's coming in and doing that? Or?
Well, it's still done by a surgeon.
Okay.
No robots here, but this is less invasive, highly successful surgery when it has to be done.
Okay. And it sounded like some of the things that you mentioned to prevent the back pain are easy to do. I shouldn't say easy, but are things that can be achieved. But you just have to commit to doing it.
Absolutely.
So maintaining a healthy lifestyle, what sounded like the #1 thing that you were saying. A big contributing factor is weight.
Weight, nicotine, and poor conditioning.
What are other ways besides that, if someone is having, if someone just can't overcome those, what are other things that they need to do? Is that when they come to the surgery?
That's when they need to be assessed. Yeah, we need to identify where the pain's coming from. Rarely, back pain can come from a fracture, tumor, or infections. And that's had to be excluded for people who have back pain that's recurring or persistent. And so that's part of our assessment every time. But so 5% of all back pain is coming from a tumor or an infection or a fracture. Vast majority of the time, it's a degenerative process.
Okay. When people come to you, they get fixed. They either do the things that you mentioned that you can do on your own besides doing surgery, or they have to have this surgery. And then they come back, after they've been healed, and they talk to you and they say, "Thank you, doctor." How does that make you feel?
Makes us feel great.
Yeah.
Because low back pain really intrudes on quality of life. It really impacts people adversely in all phases of their life. So it's very rewarding to help patients overcome that.
Awesome. Well, we appreciate you coming here and giving this advice and for offering that to our viewers. So we appreciate it. Thank you for being with us today.
Thank you.
All right. Well, new protection device.